Good evening, everyone. First of all, I would like to express my thanks to Dr. Neelam Mishra, Dr. Kiran Sinha, and Dr. Vinita for giving me this opportunity. My regards to Dr. Usha Sharma and Dr. Meera Agnihotri. It's my pleasure to introduce Dr. Bharti Maheshwari. She is Professor and Head, Department of Obstetrics and Gynae, Muzaffarnagar Medical College. She has a diploma in IVF and Reproductive Medicine, Germany, Chairperson of FOGSI MTP Committee 2018 to 2020, Fellowship in Medical Education by MCIFIME. She's in the governing council member elect. I joint secretary of UPCOG. She is vice president of Meerut Obstetric and Gynec Society, author and editor of many textbooks of OBG. She has published papers and review articles in index journals. She has delivered Kamini Rao oration and other talks in national and international conferences. She has organized North Zone and UPCOG conferences as organizing secretary. She is the National Coordinator, MTP Committee 2015-2018, Executive Member, Endocrinology Committee, and Public Awareness Committee, Medical Education Committee, 2016-2019. Now I invite Dr. Bharti Maheshwari to deliver her lecture.
Thank you, Dr. Lalita, Madam, for nice introduction, and thanks to all chairpersons, and thanks to organizer for especially Kanpur Society, Dr. Kiran Madam and Dr. Neelam Mishra Madam for initiating this efforts with Allahabad and Meerut societies. And of course, I think that all my efforts and what I am doing is because of our chief guest, Padam Shri Usha Sharma Madam. As we all have said that she is the motivation behind that are all family welfare programs, what I have learned and I have seen her dedication. Another chief guest, Dr. Meera Agnihotri Madam, and all legends, Dr. Reena, Dr. Kiran Pandey Madam, Dr. Rukna Idnani. And of course, previous speaker, Dr. MC Patel, who has done a lot and as a vice president, and when I was the MTP committee chairperson. So, and today's his talk actually has given us lots of information, and in the further processing of that information, I am coming here with some information in less 20 minutes around the POCSO Act. And as Dr. Kiran Sinha Madam has said, that please clear some MTP related case-based issue, because for 3 years I am doing the seminars in all over the country. So whatever the common issues, and I have heard in the questions in the chat box also, so I will clear that. So as you know that before starting my session, I just wanted to tell you that by the FOGSI team, Dr. Alpesh Gandhi, Dr. Atul and Dr. Jadid Tank, the FOGSI focus on MTP, all updated topics in the FOGSI focus. It is going to be available in the FOGSI website that is released in the last MCM. Besides that, the 4 MTP committee bulletins, they are already on the FOGSI website, where all forms are there, like documentation with all forms, medical methods of abortion, counseling during MTPs and MTP Act amendment, current status. So you can have all these information from available on the FOGSI website. So you can request your president secretaries. I will share with them on the WhatsApp also. These are the compressed PDF format you can have in the soft form also, and FOGSI focus in the hard copies for whoever wants. So as we all are discussing nowadays for the MTP Act 2020, it was initiated and named with the name of MTP Act Amendment 2021. So here only the 2 slides, what is the current status. We all know that this bill is to expanding access of women to safe and legal abortion services on therapeutic, eugenic, humanitarian or social ground, with a view to increase upper gestational limit for termination of pregnancy under certain conditions, and to strengthen access to comprehensive abortion care under strict condition without compromising service and quality of safe abortion. And this whole bulletin is on the in the details on the FOGSI website is there. So here just I want to tell that it is not in force now. It shall come into force on such date as the central government may by notification in the official gazette appoint. So please be careful that till date we have what are existing act, and Dr. MC Patel sir has covered all detailed of MTP Act amendment, but it is not in force now. So till date, whatever we have existing act. So we all know that every day 13 women die in India due to unsafe abortion, and not in India, 63,000 women die each year as an unsafe abortion. So this is the message from the WHO for prevention of unsafe abortion through comprehensive sexuality education, access to affordable contraception, and safe abortion care. I always share these messages in my webinar so that I can sensitize all obstetricians for prevention of unsafe abortion. And now we have to talk about certain POCSO Act. Here I want to highlight that POCSO Act is not only for obstetrician, it is for every citizen. And we all know that it is a protection of child sexual offences. So for the first time, a special law has been passed to address the issue of sexual offences against children. And before the passing of this act, sexual offences were covered under different section of IPC and did not provide for all type of sexual offences against children. There was also no distinction between an adult and child victim. Besides this, the offences have been clearly defined for the first time in law, such as offences of sexual assault, sexual harassment, and pornography. And this act has come into force with effect from 14 November 2012. It is a comprehensive law to provide for protection of children from the offences of these three terminology, and their clear definitions are there: sexual assault, harassment, and pornography. And here with this thing, special thing is here to safeguard the interest of the child at every stage of the judicial process. The system is made, and for the proper development of child in view of his protection of the right to privacy and confidentiality, this thing has been taken care of very well. So trial, and beside that, there are the designated special court for the trial of these cases, and child-friendly mechanism is developed for reporting, recording of evidence, investigation, and speedy trial of offences. The police are cast in the role of child protector during the investigative process, and they also have the responsibility of making urgent arrangement for the care and protection of the child. It also provides for the special court to determine the amount of compensation to be paid to a child, and attempt to commit an offence under the act has been made liable for punishment. And what is the mandatory reporting? Here, in line with the best international child protection standard, the act also provides for mandatory reporting of sexual offences. The act casts a legal duty upon a person, any person, either medical, either non-medical, every citizen of our country who has the knowledge that a child has been sexually abused, to report the offence. Failing to do so attract a punishment of 6-month imprisonment or a fine. And in camera, there is a trial of cases. The medical examination of child should be conducted only in presence of parent of the child, or in case of girl child by a woman doctor. Now the procedure of reporting of cases. Any person who has an apprehension that an offence of sexual abuse is likely to be committed, or knows that it has been committed, should provide information to Special Juvenile Police Unit. And if we are not aware of this unit, then you can inform to the local police. The police or a special juvenile police unit, they should make immediate arrangements to give the child care and protection first thing. Then they should report the matter to the child welfare unit within 24 hours of recording the complaint. Steps should be taken to admit the child into shelter home or to the nearest hospital within 24 hours of the report. No person shall incur the liability, either civil or criminal, for reporting the commission of the offence. And what would the failure of reporting? Any person belonging to the media studio, or any person this who coming to know about the object or material known to be sexually exploitative of the child has to inform to the police or special juvenile police. Failure to report or record this, they would be punishable, I have already told, with 6 months imprisonment or fine, or with both. And any person in charge or anything, those who want to support a subordinate, they themselves, they would be punished with imprisonment with 1 year and with fine. And false complaint by a child, it is not punishable in the act. The act provides for stringent punishment depending upon the gravity of the offence. The punishment range from simple to rigorous for imprisonment of varying periods, along with provision of fines too. The child is not to be called repeatedly to testify in court. Case of child sexual abuse must be disposed of within 1 year from the date the offence is reported. It provides for special court to determine the amount of compensation to be paid to a child. No person in any media should disclose the identity of the child. So now, how we are related as an obstetrician to this act? So we all know that it is reporting protection of children against sexual offences. I have, as an obstetrician, if someone comes to us and we come to know if there are some sexual offences has been done, so it is our duty to report the case to the appropriate authorities. I have already told, as with the other citizens has to do. Now, medical practitioners must remember that while completing the reporting formalities, it is also important to ensure that services are offered to the client and all documentation is maintained as per the provision of the law. So, and the third thing that as we are talking about the MTP, we have to report this, as I have already mentioned, the Special Juvenile Police Unit. If we don't know about that, then local police or any medical legal committees in a hospital, but which they have to further report to the Child Welfare Committee. Now, the important issue that medical practitioners, they are not obligated to file an FIR or to conduct the investigation. The provider's duty is to only inform the authorities when providing services to a minor, including abortion services under the existing provision of MTP Act. Legal proceeding, if any, can continue simultaneously and should not be hindrance in process. So please take care. You are not to investigate. You are not to do FIR. You have to just send the information. So if we see as a case-based presentation, like some girl comes to you and she wants the termination of pregnancy. Of course, the sexual activities is done and she wants this. And sometimes she tells you when you ask the age and it is 16 years, sometimes you presume that she is around 18, 20, 19, 17, but you don't know the exactly age of the girl. And sometimes she tells 19 years and you think that she is 16 or 17. So first thing is what should be the correct approach. Now any girl who is coming, you think that she's a less than 20 and she's a young girl coming for the termination. In every case, you have to ask for the age proof and you should keep the correct age proof, one thing. And sometimes you can say that patient is bleeding, she is coming with an incomplete abortion and she doesn't have at that time the age proof, then what you have to do? Of course, in every act and every day for the patient's well-being, for life-saving, you have to continue the medical process. You have to give her treatment, and you can arrange the age proof, and you can ask. But of course, now there is an Aadhaar card, and these are easily available. So you have to keep the arrange the proper age proof. Then if she is less than 18 years, please remember the age 18. If she is less than 18, of course, as I have already told, your duty is to inform to the police. Then you counsel the girl about the act, about the procedures, about the consent of the guardians as she is a minor has to be taken. If you have to do, then you have to take the consent MTP, then you have to take the consent on the FOGSI, method selection, cervix preparation in the nulliparous cervix, and procedure. So these are the important issues. Then you have to know for the young girl. Nulliparous cervix preparation is important. You have to learn about this skill, and I want to tell you that cervical preparation, it is an important part for the successful termination of the pregnancy in the young girl. And of course, you have to take the consent for the hysterectomy also. But tablet misoprostol, it is very good, in fact, medicine, which has to be given 3 hours prior to procedure. And sometimes you need additionally, but it prepares the cervix very well. And sometimes if it is not done, then you can use cerviprines or catheter balloons or syntocin infusions alternate. Now there is the one question in the young girls, what is about the preservation of product of conception. We have all had that if some girls, minor girls come under the POCSO Act, what we have to do. So here I want to tell you that when you send the information to the police, after lots of discussions, I have found this information that when you send the information to the police, you send that one line that kindly collect the product of conception if you are doing the termination within the 36 hour or 24 hours, and you keep these product of conception till 72 hours with yourself, and you can collect it in the normal saline also, and you keep it here. And if someone doesn't come, then you must have that record that you have informed to the police and requested for the collection. So if they come for the after a few months and some things, then that document will work, because nothing else can be done more than that, because it is seen that after some months some cases come and you are blamed for the removing of the evidence. Now the next question, in each minor girl, police should be, so now the question that sometimes the girls comes and their parents and they say that they don't, it is consensual and they don't know any case, they don't want any information, then please don't agree with them. In each minor girl, police should be informed and you have to counsel them. It is just a part of your duty. Nothing is going to be happen and you have to just send the information. So never do like that for the request or the patient's attendance, you don't do. And even this says that it is a consensual, you send the information. Third thing, if now the simultaneously other questions come, if any unmarried girl, she is an adult and she comes for the termination, then whether you have to send the information to the police. Now I want to say, if woman is saying that some mishappening has happened, some rape is there, so then of course you have to inform to the police, and you have to do all medical legal examination. As someone has said, Dr. Meera madam has said that you can't deny, of course you have to do all, and you have to learn all these things. But if unmarried that adult woman says that it is by her consent and she has some friend or anything, then approach is that as unmarried girl, you can terminate the pregnancy. Now, what could be the indication under the MTP? So here the MTP indications, there is a second indication that it will comes to the current MTP Act, that is the mental trauma, it can be taken as. Otherwise, in the coming Amendment Act, the contraception failure in unmarried women, that would become also in the fourth indication, that would be taken if it is because of contraception failure. Then consent, unmarried adults, consent is only by the woman is enough. But here I want to tell you that additional consent for consensual act, like sometimes she is not saying today that it is rape or something, but after 3 months someone says that it is because of rape and you have removed the evidence. So at that time, when some woman requests it, you take additional consent by in the woman's handwriting with evidence or with witnesses that this is by the consensual act, and she doesn't want any complaint against anyone. So these are, I think, some chat box, some questions for these, what I am covering in these slides. So now some important issues, I will stop in limited time. So, but whatever covered, I am doing. So first, it's as Dr. MC Patel has told everything about the violation of act. So I am telling you what is the clinically or practical things, what comes under the violation of MTP Act, what is punishment, and how can we avoid practically. So we all must remember these 4 things. That always MTP should be performed by the registered medical practitioner. It has to be under approved site under the Act and recorded on the Form 3. Third, very, very important thing, that consent has to be taken on the Form C. Opinion of RMP Form 1 and monthly reporting Form 2 has to be full. And of course, the Form 3 has to be kept, and the pregnancy should be in gestational limit approved by the law. So violation, when it is an imprisonment for 2 to 7 years if any person terminating a pregnancy who is not a registered medical practitioner under the MTP Act. This also applied for the medical termination of pregnancy also. Terminating a pregnancy at a place which is not approved, and mandatory documentation of consent, opinion, case recording, monthly, they are not adhered to. So if these things are not there, this comes under violation of MTP. Now the second most common question which I am asked everywhere, how to register, what difficulties and what requirement for first and second trimester termination, site approval, because we know many, 80% of us, they don't have displayed the site registration certificate at our clinic. So this is the form application for the site approval. Form A, this is popular with Form A, you can download, otherwise you can download with the FOGSI website, what I have sent the bulletins, and there I have kept all forms. So you can say that this Form A, and here very clearly written that for which category you want the approval for your facility. If you, and you also is in this form, it is written what requirement you need. So in category A, if you need gynae tables, resuscitation equipment, sterilization equipment, facility for treatment of shock, emergency drugs and transportation. And in category B, where you can terminate the pregnancy in the second trimester after 12 weeks up to 20 weeks, here you need additionally operation tables, anesthetics and drugs. So this once you apply on the Form A, and on the UP, I have seen there is a portal online, there is a facility for the application. Otherwise, you have to send this form to the CMO office. Once you have applied, then within 6 minutes, your facility would be visited and you would be issued this Form B approval certificate of approval, and very clearly written the your facility is approved up to to which week, 12 weeks or 20 weeks. So whenever you are going on the other centers and doing the termination, doing the procedure, please check what is the displayed at their hospital, whether it is approved up to 12 weeks or up to 20 weeks, only then you do the procedure. Because if you are eligible for MTP, but that facility is not approved, then also it is a criminal abortion. So please, and those who don't have this certificate, please arrange, and it has to be displayed at your facility. So I have already told the infrastructure. This is a very important slide for the government. For the government, they are not required to take the approval. It is automatically approved. But please remember that PSC, they are approved only for a 8 weeks termination. CSCs, they are only up to 12 weeks, and district hospital up to 20 weeks. And here the CMO is properly examining the application for approval before making a recommendation to DLC. DLC is a district level committee, which is actually giving approval for the practitioners for the termination of pregnancy. And this is a very important, and here I want to tell you that once your facility is approved, you are not required to take renewal, never, till it is approved in certain inspection. It has to be approved only once. So sometimes I have visited some societies and their CMOs are saying that you have to take renewal for every 5 years. No, it is for PCPNDT, but for MTP, you are not required to take renewal. And it is definite whether a CMO has authorized to inspect the places where they are approved to whether MTP is conducted under safe and hygienic condition, and they have a authority, CMO, they have authority to suspend or cancel your certificate of approval. If it is done, then owner may file a review application to the government against a suspension or cancellation, and after again reviewing the facility, they can reverse the order. But DLC members are not authorized to conduct inspection without permission of CMO. Now the other scenarios, this is a very common scenario when a patient, this is a 6 months postnatal, having 2 months pregnancy. 6 months postnatal, 6 months early she delivered, and now again she is having the pregnancy, and they comes to you and she is delivered at your place in the hospital, and she is not able to know what she has to do. So what is in such cases, how we have to react, what are the indications of MTP, what issues has to be covered, and what is important, because this is a very common situation. So if it is done at your sense, so we have to improve the post-delivery counseling. And second thing, we have to tell every patient when she delivered that immediate risk of pregnancy is 10 days after the first trimester abortion and within 4 weeks after a second trimester abortion, if anyone go for the abortion. But if she go for the delivered she at your place, then we have to tell her proper contraceptive method so that she should not again become pregnant in the short period. And beside that, approach, because it is seen that 80% women, they don't want to visit the hospitals for the safe abortion services because doctors' attitude, they are just like they blaming them or judging them. So this is now we have to change our approach, and we have to be accepted as, for the woman. And we must, of course, counsel her regarding what issues she has, and we must counsel her regarding taking her decision whether she wants to continue pregnancy or she wants termination. And of course, I want to tell you that contraception failure is an indication of MTP up to 20 weeks. So as we are now allowed the gestation limit 20 weeks, so it is of course indication of MTP. And so counseling is a very important class in such cases. And if at that time, if once you are doing any helping that woman for either the termination or continuing the pregnancy, then again after termination, you have to tell about before termination, you have to counsel her for choosing the contraception method. And even if she is not able to choose at that time, she is not able to take decision, then even you have not to deny her for the termination. So this is clearly written in the government's guideline. Please do not refuse MTP as she is likely to go elsewhere and go for illegal abortion and suffer complication. So assure the woman that she will not be refused MTP if even she doesn't accept the contraception method, and continue. Wait for opportunity to counsel her again and again, and continue to counsel her till she adopt the contraception methods. And all these findings should have to be recorded in your files. So MTP should not be denied irrespective of woman's decision to refuse concurrent contraception. Now, say women decide to terminate. What should be the approach, clinical method follow? Always, any woman, if she come for the termination of pregnancies, always check her legal eligibility, rule out any high risk factors, check facility at your place. Once if she's 7 weeks and see whether your facility is eligible for the first trimester termination, or if she's 20 weeks, then you see whether your facility is eligible or not. Check provider's eligibility, then you select the method, counseling of women and consent. Consent is the most important medical legal issue. So this is the flow chart. You can say what is the approach when pregnant women come for the MTP. You check the confirm the pregnancy, duration of gestational age, identify indication of MTP, discussion of method of MTP. That is called counseling, whether medical or surgical. It is total woman's choice, and her condition provide counseling for the contraception, obtain informed consent. And this is the next step in the form C. Then complete the form 1 that already we have discussed, and this has to be done simultaneously when you are choosing the patients for the MTP, and then you provide the MTP service. And then form C and form 1 has to be placed in the seal envelope. It is not to be sent anywhere. Secret and serial number has to be written in that envelope. Complete the form 3 at that time and has to be kept. These all forms has to be kept under the head of institute in the proper secure place. Only the CMO, they are authorized to inspect these forms, and strict confidentiality has to be maintained. Form 2 is to be submitted to the CMO office every month. Every 25 of days or any fixed date, we have to submit every month to the CMO office. Even in case of medical abortions, all the above form have to be filled. And please remember that missed abortion, incomplete abortion, if pill has to taken outside the facility, they doesn't come under the MTP Act. So these are not, you are not supposed to fill the form, or you are not supposed to take the form on the consent form C. All records to be preserved till a period of 5 years. Remember these 5 years from the last entry in the register. An admission register the serial number of MTP in that hospital, or each year will restart from the serial number 1 every calendar year from January. So this was medical method side eligibility. Many ask, then when we have OPD that is not registered, then what we have to do? If your OPD is not registered for MTP, then you can provide the medical method, but you must be a eligible provider, but you must have display of affiliation of your OPD with some registered place. So that has to be done. Besides that, all the records of pregnancy termination has to be maintained for medical methods also, I have already told. Consent for the procedure, Dr. M.C. Patel sir has already covered. You can see this is the form C. This is the form 1 RMP opinion form. These all forms are available on the committee activity FOGSI websites. You can download these forms. You can, and even we can share it on the WhatsApp. I will share to your president and secretary. So you can take out these forms, and these are, you can see that is the form opinion form, very clear where name and address of the medical practitioner, if it is required 1 or 2, and the woman, and beside that there are the indication. You have to just tick indication of MTP. This is the admission register. Please see this has 14 column, and this is called MTP register, admission register form 3. This has to be filled, and you have to be keep this for 5 years in your almiras or secure place. And so this was the medical method of abortion. All documentation has to be filled. And I am not going in detail about the clinical issues. We all are familiar. But please remember, up to 9 weeks, we can give a MTP. We can do the medical methods. And this is the checklist for the day 1, day 3, and day 15. And these all things are available on that documentation part or the bulletin, FOGSI bulletin. You can have, but if you will have these checklists, then it will easy for do the minimize the complication and litigation, because your subordinate or juniors, they can also check. And in the important thing is, on the first visit, you have to talk about the contraception option, as well as you have to give a contact address of your facility. Or in the third visit, you have to watch the patient after giving misoprostol for 4 to 6 hours, and you have to tell the patient that she has to report if she doesn't have bleeding in 24 hours. And in the 15th days, when you are having the visit, then you have to confirm the termination. Ultrasound is not mandatory. If it is required, you can do, and ask a woman to report back if no period within 6 weeks. And this is the follow-up card. I request everyone to use this, because I know that many of us, they don't know about this form. This is the Government of India's follow-up form, and in this whole 15 days information, and this can be shared digitally also nowadays in the COVID time. So you can manage the patient, can follow the patient. And the important issue is that card, they have a contact address of that facility and has a warning sign when patient has to report immediately. Then the second important issue is the last thing. Then in the many women gravida 3 para 2 previous to cesarean, and she is coming with a 23 weeks pregnancy with some congenital anomalies. It could be Down syndrome. Then what is the recommendation? And if it is an anencephaly, then how should we it should be handled? If she is anencephaly, then there is no issue to take out an order, because it is a management that you have to evacuate and you have to terminate the pregnancy, so you can do. And if it is a Down syndrome, you know that it is not incompatible with life in such a things, and you have to counsel the patient, you have to take the opinion of the patient and can help the fetal medicine experts so that prognosis and things can be discussed. And then if a patient decides the termination, then of course 23 weeks, so you have to take the order, court order for this termination, and then clinically you have to manage well. Any woman, if she's a scarred pregnancy and second trimester pregnancies, they are the most difficult cases to abort and they have a maximum complication. So you must be aware about the surgical methods, medical methods, miscellaneous, and dilatation and evacuation. In such cases, the cervical preparation. This is the most important part, I have already said, for the termination. And nowadays, role of misoprostol is very good. You can insert it 3 to 4 hours previously, and it is not only doing the softening of the cervix and prepare the cervix, but it also leads to contraction of uterus even before the actual procedure is initiated. So reduce amount of blood clot, possibility of perforation, and time taken for the procedure. Hysterectomy, of course, it is a last resort. And beside that, you can use a medical method WHO in the second trimester abortion according to Government of India guideline. You can use the mifepristone followed by every 3 hours 400 microgram misoprostol. Now come to the scarred uterus. If some woman is already previous to seizure, then in such patients, detailed consultations with a senior doctor must consider all variants of administration, their advantage, risk, individual approach it is necessary, with account of obstetrical anamnesis, comorbid diseases, potential complications such as hemorrhage, uterine rupture, constituting a life-threatening situation. So everything has to be told to the patient. And here in the scarred uterus, not necessary things become necessary, like you have to do the pre-abortion ultrasound, it is a must, and you have to rule out scar pregnancies by ultrasound and Doppler, counsel patient and take informed consent. This is very important. And every patient, such patient should be managed as a IPD patient. They all should be admitted, and the facility they have should have a facility for laparotomy facilities. I have already told the second trimester termination facilities should have OT facilities. Effective pain management, judicious use of medicine and misoprostol tailored according to patient. So this is the key part of the management of the scarred uterus. Then misoprostol, it is not contraindicated. But as the many studies have said that this is a large study where a patient having the 41 patient having the previous 1 seizure assistant, 10% having previous 2 cesarean sections, 11% has previous 3 cesarean section, and 2% has previous 4 cesarean section. And they have used the mifepristone in the BD doses, and then followed by on the second, third day misoprostol. And they found that safe to use misoprostol for termination of pregnancy. And they have also used the misoprostol induced abortion 400 milligram vagina every 6 hours. Rather than 3 hours, they have used it every 6 hours, and presence of prior uterus did not impact on abortion duration. And is safe for termination of pregnancy in second trimester. Besides that, in another study where they have used misoprostol 200 milligram with 6 hour interval on first day, then double the dose with the same interval on the second day, and they found that 90.3% successful rate without any adverse outcome. So finally, the scarred uterus misoprostol can be used with the tailored dose. So no evidence that it is contraindicated in the previous cesarean delivery, and the use of misoprostol in termination is not contraindicated. So we must use this for the safety of patient. Then if any woman has the medical method, after 14 days you have profuse bleeding. There is a one very common question in the short bags I have seen, that when patient is taking the pill outside and she is coming with profuse bleeding, then what you have to do as a legal formality. So here I want to tell you, these cases in our centers, it would be as an incomplete abortion. You have to manage it. And if it's a clinically stable patient, then of course you do the clinical examinations with certain investigations, hemoglobin, blood group, and you see the if product of conception they are in the cervical canal, you remove it, and if it is not, you require ultrasonography and accordingly vacuum aspiration or surgical evacuation if it is required, you have to do on the antibiotic coverage. And if woman is unstable woman and they come to it, of course we know that there are many cases. That's why we have 8% maternal mortality. It is because of hemorrhage due to such type of cases. So if such things are there, then of course we have to do stabilization treatment. We have to do the resuscitative management by the fluids, oxygens, blood, antibiotics, and then we have to see the cause. If it is atony, of course, the eutotonic drugs and aspiration. If it is a trauma, then of course we have to give analgesics and packing or suture. Incomplete abortion, then aspiration, and of course suspicion of intra-abdominal injury, then we have to do the resuscitation and refer to higher center or emergency laparotomy. So this was about the different scenarios, and we must know also aware about the identification of perforation as well as management. This is a small thing, consent whose is required. If 17-year unmarried, she is for MTP, then I have already told the consent of the guardian. 22-year unmarried, she comes for the MTP, consent of woman is enough. 18 years for MTP, then of course 18 years and above, the consent of that girl is enough. So I think we are all clear about these, and we have to learn about the paracervical block. This is the last slide. We must know that how this can be utilized in the MTP services, and I know that all of you are aware of this. We have to learn about the manual vacuum aspiration. These two things, paracervical and MVA. These are very good thing and very useful to minimizing the complication, especially in the current era and in the corona. Safe abortion and contraception, they are essential services according to the government of India, and you can't deny for this. And so finally, in the end, national policy is to make abortion safe and widely available as per the law. Abortion is legal for a number of reasons, but not for selecting the sex of the fetus. Even today, 8% of maternal mortality is due to unsafe abortion. So safe abortion services should not be jeopardized in preventing sex selection. Estimate indicates that 9% of abortion are sex selective and 90% no. So that's why there's an effort of a FOGSI, that Surakshit Garbhapat Beti Bachao ke saath, we have to continue the safe abortion services. And this is the FOGSI MTP Committee Bulletin 2020, update on documentation, including all forms you can download. And this is the second bulletin, update on medical method of abortion, the first trimester. This is the issue 2. You can also download, all informations are there, all forms are there, follow forms are there. This is MTP Act amendments current status. You can have all information related to it, but this is not in force now. And last is on the counseling. And this is the FOGSI focus. I have already told you, medical termination of MTP by blessings of my teachers and my seniors. I could make it possible by the FOGSI president also. And in the last, I want to say that we have to adopt comprehensive abortion care. That is not only MTP means only uterine evacuation. We have to learn and we have to adopt in the practice the counseling, obtaining voluntary informed consent, clinical assessment, pain management, uterine evacuation, managing complication, post-abortion counseling, and post-abortion contraception. So finally, this is according to WHO, access to safe abortion depends not only on the availability of services, but also on the manner in which they are delivered and the treatment of women within the clinical context. So services should be delivered in a way that respect a woman's dignity, guarantee her right to privacy, and is sensitive to her needs and perspective. So this thing we have to adopt in our practice. Attention should be given to the special needs of the adolescents and other vulnerable and marginalized women. So thank you very much for this patience hearing, and on the FOGSI website, my number and email is there, and here also. So you can ask or you can request for anything related to MTP. Thank you very much.
Thank you, Dr. Bharti Maheshwari, for such an excellent talk. I think all the doubts will be clear. And now I request Dr. Amrita Chaurasya to summarize the talk in a very short and a crisp manner because we are already late.
Yes, Dr. Vinita. Thanks a lot, and thank you for including me as a part of this webinar. Dr. Bharti has, I think, elaborated every POCSO Act as well as the case scenarios in a very elaborate and a very clear way. And we are all witness of our very hard work as a chairperson MTP committee since the beginning. So congratulations, Dr. Bharti. Though there are many questions in the chat box, also there are many questions in the minds of the audience there, but we are very short of time. So I think we will go ahead with the next session. Just one part I would like to emphasize here. Like you said, if you receive a minor girl for MTP or for anything, you will have to report the police before that. So it is being in a medical college, being in a government institution, it is always easy. But being a private practitioner, I think it will be not an easy job. And additionally, if you do MTP and you inform the police and you do MTP, so later on they may claim that you have abolished the evidences, like you have not got her medico legal done before tampering with the part. So that is a practical situation that may be faced later on.
Dr. Amrita, but we have not to compromise for even we have difficulties a lot, but we have to send information with request to collect the products of consumption. That
Yeah,
is the,
that.
yeah, Dr. MC Patel, sir.
Yes.
We have already cleared
Yes,
about
yes.
that.
In the chat box.
I have selected some important questions. Most of the questions have been answered by the speakers. And now coming to very important questions by any speaker, Dr. Bharti or Dr. MC Patel. One question from Dr. Papa Dasari. 8 weeks pregnancy for MTP and sterilization has come, and she was tested COVID positive prior to admission. Should she wait for doing medical abortion or not? What is your view, sir?
Bharti, you write it. Bharti.
Yes, yes. Doctor, if some patient is, what I could understand that
8 weeks pregnancy
was
for
COVID,
MTP and sterilization.
she is COVID positive and she came for the MTP and sterilization. What I could understand. So okay, first
for medical abortion.
Okay, she's for the medical abortion. So in COVID positive, of course, it is essential services abortion. You should not deny, you have to do. Now the thing you have to see that because abortion is a time sensitive procedure, so if it is a medical abortion patient is eligible, you can give medical abortion pill in the COVID positive patients, of course, but you have to maintain the all documentation and you have to confirm her gestational age and then you have to do this. Now regarding the sterilization, of course, the COVID treatment is also priority with that thing. So according to the severity, according to the treatment, once abortion, medical abortion, and once a patient is cured from the COVID, then you can give a ligation. I think so, because it is not an emergency procedure and we know that we have to follow the protocols. That is the thing.